Here at Mid-America Plastic Surgery, we offer surgical and non-surgical options for a lot of areas that might not cross your mind. So one of the most popular areas that we can inject that would be a surgical alternative is the buttocks. This area can be stimulated by a couple of our different biostimulants without having the surgical downtime. Ashley Nath and I are going to dive into this today. My name is Ciara Bickline. I'm one of the nurse injectors here, and Ashley is one of our nurse practitioners.
Hi. So we're going to start going through the different slides just to discuss kind of the different options that we have. Obviously surgery is going to give patients the most dramatic results that you can get with a BBL, but there's sometimes patients that are not candidates for surgery. They maybe do not have enough fat to transfer for the BBL, or maybe they already had a BBL and are just wanting some extra volume in that areas that they don't want to go through fat grafting again. So we're going to start with the products that we can be used for these areas. So both Radiesse and Sculptra are biostimulants that we have here at the office. We use them in the face and other areas of the body a lot, but they also can be used in the buttocks as well to add that natural kind of looking volume to help not only the volume in that area, but also the skin quality, and sometimes just changing the shape. If someone has problems with a hip dip on one side or the other or both, we can kind of correct some asymmetries as well with these products.
So, we're going to dive into those biostimulants that we talked about. So, the word biostimulant basically means that we are injecting a substance that's going to cause the body to grow collagen, elastin, um, and we have a couple tools that we use. So, the first one that I'm going to go into is Radiesse. This is calcium hydroxylapatite. And basically, what that means is this is a very versatile injectable. So this one here can give you a little bit more structural support a little bit quicker than our other biostim. This one can create type 1 and type 3 collagen, which means that you're going to have a nice long lasting result. But we can also really tailor this to exactly what you need. And this is why we do like to bring you in for a consult so that we can decide, all right, for this particular person, they're going to need X amount of Radiesse and X amount of Sculptra because one person might have different concerns than another.
So the other injectable product that we can use that's considered a biostimulant is Sculptra. We use Sculptra a lot in the face, but we also can use it on the body as well. The nice thing about Sculptra is it is a gradual treatment. So whenever we do the treatment, it's going to take about 3 to 4 months before you start to see the real volumization and the results of the treatment. Whenever we do these, it's usually a series of treatments, and we'll go over that more in detail. But usually, people need at least 2 or more treatments and more of a series type of injections.
So, as we've discussed, a consult really is necessary for this type of treatment. It can really, really change the number of syringes that we use, the price point, depending on how you naturally present. So, in the consult, we'll go over all of this with you. We'll talk about downtime, exactly how the procedure looks. I know that these videos can look a little intimidating, but surprisingly, this is not a very painful procedure. Afterwards, you will be a little sore and a little bruised, but you're not going to be in a lot of pain during the treatment at all. I personally have had this done and it was very tolerable. I was able to hold a conversation during the entire treatment and just felt some pressure, maybe a couple sites that were a little bit of a sharp pain, but it's very quick. And luckily, we've got some great injectors here that'll take care of you.
Yeah, and we do use numbing too. So there's numbing in most of the solutions that we're actually injecting, as well as using some numbing, injectable numbing at the sites where we go in. We usually use a combination of cannula and needle when doing this treatment. It kind of just depends if we're treating more for that skin laxity or more cellulite, or if we're trying to get that volumization. So again, that is something that we'll go over in a consultation with you, so we can kind of really get that customized plan for you.
So, as previously mentioned, downtime is very mild. So, you are going to have some tenderness and soreness. The swelling that you have immediately is something that most clients will wish will stay. However, some of this is inflammation from the procedure, it could just be swelling from the product itself. With one of the biostims that we use, there is a lot of saline that we have to add to it to actually get it into the body. So your body will naturally reabsorb that over approximately 24 to 48 hours for some people, maybe even up to 72, and it will go down. So I do let people know like you have to be patient with this procedure. It takes the body time to catch up to the treatment. You can also feel like slightly like lumpy bumpy. You can feel some firmness, some almost like I think nodule is a strong word, but maybe like just some more firm areas. All that's very, very normal for the first few weeks, and it will go down. In this photo, you can see that the bruising can be a little gnarly, but it's a good thing to do whenever you don't have any big trips planned, which is also something we go over in the consult.
So the next thing we're going to talk about is the non-surgical BBL timeline. So as we kind of both talked about, both of these products are gradual, so it's not going to be that instant gratification. But within the first 1 to 2 weeks after the treatment, that swelling, the bruising is going to subside. Unfortunately, like we said, that water, the saline carrier is going to be gone. So that instant volume you had right after the treatment will be gone, especially with the Sculptra. So after that, about 4 to 6 weeks, some people will notice some improvement in the skin texture and quality. You might just start to see some firmness in the skin, maybe some slight volume, but that volume aspect is really going to come closer to that 3 month mark. That's where we can really start to see the skin thickening and the actual volume from the product itself. And during that 3 to 6 month range, you are still going to see visible improvement in the product. It's just going to keep on looking better and better. It's a little bit different than a lot of things we do where you have that instant gratification and then it goes away. This is actually going to get better over the first 6 months of the treatment. After the first 6 months, your results are going to be longer lasting than, say, with like a regular filler or something like that if you've had it done in the face. But there's no like set timeline. We are going to need touch ups at some point. Unfortunately, most of these products have about a 2 year indication. We know there is some volume left after that. It's not like it's going to be at the 2 year mark, everything is going to be gone. But we'll talk in the consult about needing kind of reoccurring touch ups out times to get that volume to stay how you want it. So now we're going to go over some frequently asked questions. One of the most common questions I think we get is a non-surgical BBL safe? There's always going to be risk involved with any procedure we do, but the non-surgical BBL is considerably safer than the surgical. You don't have the risk of anesthesia and some other things that can come along with that surgical procedure. But anytime we are injecting a product into the skin, one of the main concerns we have is staying out of any vessels. This product is very, I would say, fluid, liquid like. So its risk of cannulating a vessel and causing some problems is pretty slim. But that is why we take steps in making sure we're in the right planes, injecting this product correctly. And we do like to use cannulas a lot to prevent those problems from happening.
Another question that we get a lot is how many sessions do I need? And unfortunately, this is a very gray area. So, the nature of a biostimulant is seeing how it responds in the body. With what Ashley was saying earlier about how this does take time to really show like its full potential, it's really a discussion that we have to have at that moment. For somebody that has like extreme volume loss, a lot of laxity, a little bit more severe aging to that area, I would almost count on doing multiple sessions. On the flip side, if you're, a younger person, maybe in their 20s or 30s, that regularly works out, that has very mild skin laxity, it could just be one session, but it really depends on the client.
Another question we get asked is obviously the price of the treatment. That's something we all would like to know. This does vary greatly because patients are going to come in maybe just to have their hip dips treated or full augmentation. And so this varies greatly. I would say roughly patients are going to need anywhere from 10 to 20 syringes or vials per treatment. And so this is why the consultation again is so really needed because it is going to vary from patient to patient. We do offer some financing options. We are able to break this up in multiple treatments. It kind of just depends on how quickly you're wanting your results. But there are ways that we can work around budgets. But it is hard to give you a just black and white answer of cost because it is going to vary so greatly from patient to patient.
Does this hurt? So, like I said, I have actually personally had this done, and this is one of the more comfortable procedures that I have went through. We do numb the area with injectable lidocaine, which can really make this procedure a breeze. You are going to have some soreness and tenderness after the treatment. You'll notice it especially like when you're sitting down, if if you've had your hip dips treated and you turn over in bed, you're going to feel that tenderness, but it's nothing that a minor NSAID cannot take care of. I think this one is surprisingly easy.
I would agree. We've both had this procedure done, so we definitely have the experience with it, and it's not bad at all. And that kind of leads us into another question is how long is the recovery? So, like Ciara said, we are going to have some tenderness afterwards. But that really, I feel like just lasts for the first couple days. That it feels like a bruise. So, like, obviously, you're going to be sitting on your buttocks. So, sometimes that first couple days when you're actually sitting and putting pressure on it, it's going to feel like you're sitting on a bruise. The bruising, I would say, is the longest part of the recovery process and does vary from patient to patient. Mine like to hang on a little bit. So, I would say even maybe up to like 2 weeks, I still had some of that kind of like light yellow, greenish bruising that you could still see. So sometimes this is, a good fall, winter project when it's not swimming suit season, but the recovery is pretty easy. We do usually like you're going to be sitting on it, so you're not going to have to do a lot of massage, but we do like you to massage for the first couple days, which is, something that we'll go over in the consultation as well, depending on where we injected it, if you need to do that or not. But I would say the recovery is a pretty easy one.
Yeah, I agree. And not a lot of restrictions either. I mean, after the procedure, I prefer that my patients avoid like strenuous exercise for about 24 hours. But other than that, I mean, it's really just infection prevention. Like, I want to make sure that those channels that we created stay clean. So, really just being mindful of that. But otherwise, there's not a lot of restrictions at all. There's no weight restrictions. If you have a family and you need to lift up your kids, that's no problem at all. Which is also why sometimes this fits the patient's lifestyle a little bit better than surgery.
And the last question is when will you see results? And obviously, we just kind of talked about that in the previous slides, but I would say about that 3 to 6 month mark is where you're really going to see the majority of your results. You might start to see some skin changes in that a little sooner, but the bulk of the volume in that is going to be at that 3 to 6 month mark.
If you would like to learn more about this, you are welcome to come in for a complimentary consultation. We do offer these just so that you can get an idea of what this procedure looks like more in depth and what it would look like for you personally. At this, we can assess you, we will look you over, give you pricing, see exactly what's needed, and answer any further questions. So feel free to call or text us at 618 288 7855. Thank you.
Thank you.